Well, there are lots of changes to our bodies as we age. Most of them we can see, while others we can just feel. In particular, when our hormones change. Dr. Gina Tutera has been treating men and women for 40 years, helping them to get their health back by balancing our hormones. Congratulations, Dr. Tutera. 40 years in private practice.
Thanks.
That's
very
amazing.
Exciting.
Yes, it is very exciting. Now, let's talk about, first of all, we hear a lot about hormones and,
Sure.
and the loss of our hormones, but what in particular are we talking about? Is it something that happens to everyone just because we're aging, or is it some sort of imbalance?
Actually, it's the hormone production in both men and women starts in our 30s. So when we start losing that production, then the changes that are affected at that point in time are what lead us to gaining fat around our middle, losing muscle mass, becoming less sharp mentally, and not being able to be as emotionally stable as we once were. And actually, as I tell all of my female patients, the first day you go into menopause is your first step towards dying, because without their gonadal hormone, the ovarian and testicular hormone in men, you're going to start developing cardiovascular problems, musculoskeletal, cerebral, and metabolic.
Whoa. Okay, well, that's scary, actually. You just scared me right there. So how do we know? I mean, seriously, there's enough going on in life. We have a lot of stress. Everybody gains a little weight. How do you really know that your hormones are a problem then?
Well, the only way you can actually do that is basically being evaluated with, by someone. We love using lab work because the ability to have that objective evidence in front of you, numbers don't lie. And so if you have that objective evidence and then couple it with what the problems the patient has, you can very much correlate, and say to them, this is why you're having your problem, and this is what I can do for you.
I gotcha. And we're talking about lab work. You're talking about a blood test?
We use blood tests because we check pituitary hormone, and that can only be derived from blood. You can't get it from saliva. And it's pituitary hormone that tells you whether or not you have deficiency in the gonadal hormone, the estrogen, the testosterone, and all. And
I know that you've written several books. You do tons of lecturing. You've been all over the world talking about your particular, I'll call it a delivery system. But,
right.
But what does that mean exactly?
Well, this is, the pellet system is the only system that allows your body to control the release of the hormone. And it does it in a very unique manner. And why we're unique is because of the fact that we're using a formula that I have patented to be able to individualize the therapy to each individual patient, so that it's not one size fits all, which is how I was originally trained when I came out of residency, is that same dose for everybody, which made no common sense.
And we hear that so often, my normal may not be your normal or her normal, and that's really what you're trying to say. And so when people see SottoPelle, that means that's your patented system.
It's exactly, you hit it right on the head, is that we use a unique formula which I developed and have patented, and basically that formula allows us to take in a number of factors, not just lab work, to calculate that particular dose that's going to be right for you or your friend.
All right. Well, good information as always, Dr. Tutera. And once again, congratulations, 40 years. And because of Dr. Tutera's 40 years in practice, he's celebrating his anniversary with you. He is offering new patients a special price. It's just $40 for a consultation. By the way, that's a savings of nearly $150. All you have to do is mention hormones when you make your appointment. Call 480-874-1515. You can also visit their website at SottoPelleTherapy.com, and make note the offer is good through August 31st.